dear postgraduates, today's class will be on vaccinations. So this class will be on the vaccinations, not only the diabetics and also the non-diabetics. So there are 10 reasons to get the vaccinated. Vaccine preventable diseases have not gone away. So still today, your influenza, your pneumococcal, your HPV, etc. there. Vaccines will help keep you healthy. Vaccines are as important to your overall health as the diet and exercise. I think they are very, very important along with your diet and exercise. Vaccines can mean the difference between the life and the death. So definitely it protects a lot of the people from the life-threatening complications. So increasing your aging. Vaccines are very safe. They cannot cause the diseases as they're designed to prevent. They contain very, very small, whether the live or the dead bacteria, which won't cause the disease, but that can improve your immunity. Young and healthy people can get very sick. So these infections, your pneumococcal vaccines, etc., infections, even can then affect also the young and the apparently healthy population. Because in India, the diabetes, hypertension, obesity, your metabolic syndrome is at the age of 20 plus and the 30 plus. So even though they are very young, according to the age, and they looks like healthy, but apparently, but definitely they had a lot of the comorbidities in them. So definitely they will prone for a lot of infections. Vaccine preventable diseases are expensive once you admit in the ICUs with any sepsis, etc. So the price will be very, very high. So obviously any admissions, they are all expensive, provided if you admit in the ICUs and in the private hospitals. That's what we do. Most of the Indians, they do that. More than middle class, upper middle class, usually they try to admit in the private hospitals rather than in the general hospital. Now the general hospital means 100% below poverty line. When you get sick, your children, your grandchildren, your parents, your colleagues, they are also at the risk. Your family, your friends and co-workers need you. So that is the reasons everyone has to be vaccinated against lot of the diseases. There are the certain myths and the common concerns about the vaccinations. Vaccines cause diabetes or vaccines cause diseases. No scientific evidence. Vaccines do not cause or worsen the diabetes or any other disease. Vaccines contain the harmful toxins. Good explanation is ingredients are very safe in tiny amounts. They contain very, very small amounts of your bacteria or the viruses. The no harm was proven with these vaccines. So they are not harmful toxins. Vaccines cause disease? No. They are made with inactive parts. They cannot cause the disease. Natural immunity is the better? Yes. Vaccines provide the safe immunity without the risk of the severe illness. So your natural immunity will be protected. On top of that, your immune system also will improve because of these immunizations. Vaccines change the DNA. No. Messenger RNA vaccines, they do not alter the human DNA. They teach immune response only. Vaccines cause severe side effects. Most of these side effects are very, very mild and temporary. Severe events, anaphylactic shocks, etc., they are very, very, very rare. So these are the certain myths are there in the society, and these are the explanations for those myths. So you all know that this diabetes or any hypertension or metabolic syndrome is growing in a tsunami proportion. But what is more important is 81% live in the low and the middle income countries like India. So unfortunately our people, they are at high risk of these diseases, not only your communicable diseases and also the non-communicable diseases. Diabetes is a major public health and economic challenge worldwide, and so in India also. Why there should be an immunization in the diabetes? Diabetes weakens the immune system, increasing the infection risk. Vaccines protect against the serious illnesses like influenza, pneumonia, Hep B, COVID-19, shingles, respiratory syncytial virus, HPV, etc. Vaccination reduces the hospitalizations, it reduces the complications, and also reduces the mortality in all the patients. It improves the overall diabetes control by preventing the infection triggered blood sugar levels. So once there is an infection, obviously the blood sugars will shoot up. And in the presence of the blood sugars, again the infections will shoot up. So this is a vicious cycle. Despite the benefits, vaccine coverage is very, very, very low in Indian population. We know the advantage of these vaccines, but still among our doctors' professions themselves, the coverage is very, very low because of the lack of the awareness and lack of the healthcare providers. Immunization is a key cost-effective strategy to improve the health outcomes in diabetics and also in the non-diabetics. Why infections are very common and very severe in diabetes? You all know these reasons. High blood sugar weakens the immune response. Poor circulation, so because of your peripheral vascular diseases. Nerve damage, because of your neuropathy, a trivial injury will lead to a lot of the infections. And then the sepsis. And there will be the increased risk of your skin, subcutaneous tissue, urinary tract, respiratory, soft tissue, meningeal, etc. etc. Hyperglycemia promotes the pathogen growth. So all the bacteria and fungi and the virus, they love hyperglycemia medium and they grow in very big numbers. Complications from the infections. Higher rates of the severe infections like pneumonia, sepsis and surgical site infection. These are also very common because the diabetic individuals, they need a lot of the surgeries. Either head and neck surgery or your cataract surgery or your knee replacements or your kidney replacements, etc. etc. So they need a lot of the surgical procedures and they need the admission, they need the anesthesia workup. So these are all very important. They leading to the hospitalization, the mortality in the presence of very severe blood sugars. What are the common vaccine preventable diseases? So these are all the preventable diseases. As a good postgraduate, you are supposed to say all these diseases. Unlike our Vikas and Janardhan. Okay, so they told only few, maybe 25%. See the diseases: influenza, pneumococci, Hep B, COVID-19, your tetanus, diphtheria, pertussis, that's Tdap, especially for your pregnant women, herpes zoster, shingles. So to avoid your hepatic neuralgias or hepatic ophthalmicus, meningococcal vaccine. So very, very important in people who are moving to the Kumbh Melas and then what is this, once in 12 years, Rajamandri, Pushkaras. So these are the pilgrimage centers. So definitely those people who are at risk of getting these infections, they should be given the meningococcal vaccine. Hep A, yes, typhoid vaccine. When they are traveling to the endemic areas, suppose your friends are residing in UK or US or in Europe, they want to travel to India to meet you. So definitely they should be given the typhoid vaccine because that is very, very prevalent here. Yellow fever, if you want to go to the Africa or Kenya, etc. So the yellow fever vaccine is a must. And HPV vaccination. So this is a must for all the girls and the boys. So not only it reduces your carcinoma load, not only your carcinoma cervix or the ovary or other organs. So definitely it's a very, very good vaccine to be given all these individuals. So these are the list of the different vaccines available in India, and everyone has to get these vaccinations as and when required. Otherwise, if they get these diseases, they are all life-threatening, and sometimes no, they are very, very worrisome diseases, especially your shingles. So the people will face a lot of the troubles with your herpetic neuralgia. So herpetic neuralgias, very, very painful neuralgias. So hospitalization and the mortality rates, the influenza, up to the 79% of the hospital admissions reduced by the vaccination. Okay, your H1N1, your H3 and 2. So these are a lot of the epidemics have occurred all over the world and also in India. So a lot of the people are exposed to these viruses and they got admitted with these pneumonias and lower respiratory tract infections. And then finally, most of these people, they die because of the sepsis and other acute kidney injuries, ARDS, etc. So it's a very big disease, 100% curable with your vaccination. Of course, it has to be given once in a year. So it contains a lot of the polysaccharides. So all these viruses, though definitely it should be given at least 1 month prior to your seasons, between September to December. Pneumococcal vaccine, they get a higher hospitalization risk versus the general population. Even today, the pneumonia is a big threat to the mankind. Even the lot of the very VIP people also, they die of the pneumonias in the ICUs. Once they get the fever, cough and breathlessness, and not relieved with your regular drugs, on the 4th day and 5th day you take an X-ray and it shows some patch, and still the people is there, still he is not not under good control with your antibiotics. Then there is slowly the saturations will come down, then there will be the tachycardia and loss of appetite. He develops the fever, chills, rigors, etc., and needs a CT chest that shows lot of the infections there, and then admitted in the hospital, and finally after 10 days or 15 days or 20 days, even after ECMO or your prone ventilation, etc., so the finally death card. So very common with the pneumonia. So don't underestimate the severity of the pneumonia. So this is a very big disease, and everyone has to be protected with the pneumococci. So you have the vaccines. You have the PCV, that is the pneumococcal conjugated vaccine, 13 and 20 and 23, and also you have the PPSV, pneumococcal polysaccharide vaccine. So earlier we used to give the PCV 13, and after 1 year we used to give the PPSV 23. Now the PCV 20 is available in the market, which should be given once in the lifetime. Okay, you need not have the booster dosages for this PCV 20, that is very much available in the market at the price of 4,999 rupees. Okay, so the benefits are very high. So that is PCV 20. And COVID-19, you all agree with me that lot of the controversies about these vaccines is also there. So a lot of the people, they develop side effects of these vaccinations. Some people, they develop the dementia. Some people, they develop the vasculitis. Some people, they develop the premature atherosclerosis. Some people, they develop myocardial infarctions or pulmonary infarcts or pulmonary embolisms, etc. Everyone, they blamed COVID-19 on one hand and the COVID-19 vaccination on the other hand. But still, we don't know that. But definitely, the mortality is reduced by 95%. I don't think that 95%, at least 60 to 75% with your vaccination. So vaccination is still, it is very useful for all these. But lot of the controversies are there among the COVID-19 vaccinations. Hep B, no controversies, 100% safe. So it has to be given the 3 dosages, 0, 1 and 6 for all the general population, except the people are on the hemodialysis are planning for the transplantation, where you have to give the 4 shots, 0, 1, 2 and 6. Not only the 4 shots, double dosages. So 0, you have to give the 2 dosages, and the first month you have to give the 2 dosages, second month 2 dosages, and the 6th month 2 dosages. That is the usual dosage of your Hep B, those people who are on the hemodialysis and those people who are posted for your transplant program. Shingles, excellent vaccination, but unfortunately not very much utilized. It is very much underutilized vaccination. You have to give the 2 shots, 0, and the second shot should be given between the 2 to 6 months after the first dose. So vaccines reduce the incidence and post-herpetic neuralgia. So influenza vaccine, the vaccine name is inactivated influenza vaccine. It is annual, preferably before the flu season. So depends on the area to area. In South India, it's maybe September to October, North India, West India, etc. Recommended yearly to reduce the flu complications in the diabetes. Every year the strains will change. So that is the reason, preferably you have to give the once in a year, and it is not a very costly vaccination, costs about 600 to 800 or 900 rupees. Worth it. Pneumococcal vaccine, already I told you, the PCV 20 is available right now. It's the once in the lifetime. So definitely have to give the pneumococcal vaccine for all the people, not only with the diabetics, with the metabolic syndrome, and also in the elderly population, immunocompromised individuals, etc. Those people on the steroid therapy, those people are on immunosuppressive therapy, they are the ideal persons to go it. Hep B vaccination, these already I told you, 0, 1, 6, 0, 1, 2 and 6 for the hemodialysis and transplant program patients at double dosages. Tdap, excellent vaccine. Tetanus, diphtheria, pertussis, especially for the pregnant women. So during the pregnancy, so definitely every antenatal, during the antenatal period, so all our OBG friends, they advise the Tdap vaccination. So single dose, boosters every 10 years, recommended for the adult to prevent the bacterial diseases of these life-threatening diseases, tetanus, diphtheria, and pertussis. Shingles vaccine, so this already I told you, 2 dosages. First dose and the second dose between the 2 to 6 months apart for adults more than the 50 years. Recommended due to the higher risk of the shingles in the diabetes and also in other immunosuppressive diseases. COVID-19, so we have the 3 or 4 vaccines are available as per the national guidelines, including the boosters. Respiratory syncytial virus, Janardhan told that this is not available in India, but it is very much available in US. So they give it respiratory syncytial virus in two set of the populations. In one set, neonatology and the pediatrics. So between 6 months to up to 6 years, or that less than the 10 years, they give one shot, respiratory syncytial virus. And the second one is in the adults more than the 50 years or the 60 years. It's a very good to reduce your lower respiratory tract infections there. Varicella vaccine. So this is also available. Live attenuated vaccine, 2 dosages. First dose and the second dose after 1 or 2 months. Considering those without the history. So what are the contraindications for these vaccinations? Relatively there is no definite contraindications, but there are relative contraindications like severe allergic reaction, anaphylaxis after a previous dose of the vaccine or to any vaccine component. I have not seen a single person who developed the anaphylactic reaction to the vaccine. Okay, but he developed if any history of the anaphylactic shock to the previous any vaccine, so you should be very careful. Okay, so for live attenuated vaccines, some varicella or shingles vaccine if used, avoid in severely immunocompromised patients. Acute severe febrile illness, so don't give it, just postpone it. When the temperature is 101, 102, 103, 104, just wait for 2 to 3 days. Once she is afebrile, when the person is afebrile, then you can introduce the injection. That is a relative contraindication. And the specific contraindications related to the vaccine type must be observed. No live vaccines during the pregnancy. That is the very, very important take-home point. So during the pregnancy, don't give any live vaccines. Okay. So you can give the Tdap vaccination. Precautions. So moderately or severely ill patients with or without the fever may have vaccination deferred until the improvement. History of Guillain-Barré within the 6 weeks of a previous influenza vaccination is a precaution for further influenza vaccination. If you develop GB syndrome following any vaccination, so be careful that. Bleeding risk for IM vaccines. Suppose if the person is on anticoagulants. Okay, so he may be undertaken your mitral valve replacements or aortic valve replacement. He is on acetylene, maybe 2 mg or 3 mg or 4 mg according to your INR. And if you want to give the IM injection, so definitely there is a chances of hematoma. So this is a very important. So you should be very careful in drug history also. As a physician, you should be very, very careful about these things. Immunocompromised states in the diabetes due to corticosteroids or other immunosuppressants may reduce the vaccine efficacy. Vaccine is still recommended unless contraindicated, but timing should be optimized. So the efficacy may be reduced. Sometimes you may give the double dose also. That's what happened in your Hep B in people at hemodialysis. Monitor the blood glucose levels around the vaccination time as mild transient hyperglycemia can occur. Inform the patients about expected minor side effects to reduce the vaccine hesitancy. So maybe the mild side effects, maybe the pain, maybe the redness, maybe the itching, maybe the giddiness, or maybe the nausea, some headache, some feverish sensation. So these are all expected side effects, but they are very transient. You need not worry about these transient side effects. But you should tell to the patient about these side effects, and when he or she told these side effects, so you should console them and you see the vital data. So if it's normal, so definitely, otherwise you please observe that patient for about 1 or 2 hours and then you can get out. So vaccine prevented diseases. See the burden of the influenza in diabetes. So India has experienced the frequent influenza outbreaks with the recent surges of aggressive strains like H3 and 2 in northern region affecting the millions of the individuals. People with diabetes have a higher risk of severe complications including pneumonia, bronchitis, and exacerbation of your COPD and other existing cardiovascular and pulmonary diseases. Hospitalizations and mortality rates are higher in the diabetic with influenza compared to the non-diabetic populations. Despite the high risk, influenza vaccination coverage in India is very, very, very low. We all know that the definitely vaccines are available. We know the price of the vaccines also. So the vaccine options, you have the trivalent vaccines, the influenza vaccine, you have the two types of the vaccinations, trivalent and the quadrivalent. So obviously the quadrivalent is more popular and more superior when compared to the trivalent. If efficacy, yes, a significant reduction, more than 50% in influenza infection risk and related complications of the diabetes after vaccination. The pneumococcal disease. 2 to 3 times higher risk for the invasive pneumococcal disease. So that is IPD. IPD is invasive pneumococcal disease. Not only your lungs, but also in other organs also. Sometimes with the bones, severe osteomyelitis, etc. It's very, very difficult to treat. Sometimes with the brain, maybe brain abscess or your meningitis, etc. Okay. High rates of ICU admissions and case fatality. Okay, fine, they admit in the ICU, but the recovery is not a rule. He may recover, he may not recover. He may go to your house or he may go to the mortuary. So that is also there. So high fatalities is also there with this pneumococci. Poor glycemic control and younger diabetic patients at the greatest relative risk. Immunosuppression due to hyperglycemia, recurrent healthcare exposures, etc. Vaccines, pneumococcal conjugated vaccine. I told you 13, 15, 20. Now my favorite is PCV20. It is available in the market. Strong immune memory, T-cell dependent response. Recommended for all adults with the diabetes and also non-diabetics. PPSV, that is a pneumococcal polysaccharide vaccine. Border serotype coverage, T-cell independent response. So T-cell dependent response is your PCV. T-cell independent response is your PPSV. Whereas PPSV is T-cell independent immune. So the boosters are required for your PPSV because it's not T-cell dependent. Whereas for the T-cell dependent immunity don't require any boosters. That is the reason once in lifetime vaccination is available. So this is an excellent vaccine. Hep B prevalence in the India in diabetes. Around 8.4% of the HbS is positively reported in some Indian diabetic populations. So they are more prone for these diseases because of frequent pinpricks, frequent admissions, frequent IV fluids, etc. So they are more prone for the injectable introduced diseases, and one of these diseases is Hep B. Increased due to the frequent healthcare exposure, compromised immunity, and blood glucose related immune dysfunction. Vaccine recommended, vaccine schedule I told you, efficacy is very good, highly effective, more than 90% preventing Hep B infection and chronic liver complications. So now you should be very careful about your liver health. Liver health is very, very important. Even a 1 ml of alcohol is injurious to the liver. For heart, okay, 60 to 90 ml is okay. But as far as the health, liver is concerned, so very dangerous. So liver health is very, very important. Fatty liver, very common in the society. So now the name has changed. MASLD, metabolic dysfunction associated steatotic liver disease. MASLD. Okay, so first it starts with simple hepatomegaly, steatosis. Then there will be the steatohepatitis, that is inflammation. Then there will be the fibrosis. Then there will be the regenerating nodules or cirrhosis. And then hepatocellular carcinoma. And then death. So I think in the next 10 years or 15 years, so every hospital should have at least 50 to 100 bedded liver ICU units. Like your cardiac ICU, neuro ICU. So the people, the future Andhra Pradesh will definitely need liver ICUs. Within the brackets, alcoholic ICUs. Okay, your alcoholic gastritis, alcoholic hepatitis, alcoholic pancreatitis. So it's very, very high. Every day I see at least 1 or 2 cases related to the alcoholic gastrointestinal systems. Very high in the society. So you should be very careful about these alcoholic ill effects on the health, including your alcoholic encephalopathy, etc. etc. I think again that is a very big topic, alcoholism and its effects. Okay, so Hep B liver health. is very important. So vaccination is very important. So prevents co-infection, which can worsen the liver and the metabolic outcome. Some people, unlucky people, they will have Hep B and also Hep C. Combination of B and C. Some people will have Hep B and HIV. So that is also possible. COVID-19, 3 times higher risk of the death from the COVID-19 in type 2 diabetes. So that depends, the 3 times or 30 times, depending on the control of the diabetes and presence of other comorbidities, etc. And age, or a known PTCA or post-CABG and post-CKD, etc. Increase in severity, ICU admissions, complications in the diabetic patients. Poor blood glucose control linked to the worse outcomes. So the more the HbA1c at the time of the admission, the more the mortality. All people with the diabetes should receive updated COVID-19 vaccination as per the national guidelines. Prioritize the boosters, especially for elderly and those with the comorbidities. Continue masking, hand hygiene, avoid crowded places during the surges. Seek early care if symptoms develop. So maintain the optimal diabetes control and routine medications. It is a very, very fast growing disease in 2020 and 21. So today he developed cough, breathlessness, and tonight hypoxia, tomorrow morning death. It's a very, very deadly disease. I have not seen a disease like COVID-19 so far in my life. Presence, aggression, death. Very, very common, COVID-19. Tdap. So tetanus, diphtheria, pertussis. Why and when? Diabetes increase the risk of infection, serious complications from tetanus, diphtheria, and the pertussis. Patients with diabetes have higher risk of hospitalization of wound infections. Single dose, at least once in the adulthood, followed by tetanus and diphtheria boosters every 10 years. Recommended for all adults with diabetes regardless of the age. Women with the gestational diabetes should receive the Tdap during each pregnancy. Nowadays, know whether the gestational diabetes or not, all women will receive one shot of the Tdap during the pregnancy, during the first half of the pregnancy, before the 12th week. Boosters recommended for the wound management if more than 5 years since the last dose. So most of the people know every time they get the injury, they get one TT injection. That is not ideal, not advisable also. Maybe once in 5 years, it's okay. Herpes zoster in patients with the diabetes mellitus. See, the diabetes increase the risk of the herpes zoster by 30 to 40% compared to the general population. Higher hospitalization rates and complications in the diabetics. Impaired cell-mediated immunity to varicella zoster virus in the diabetes. Glycemic control effect is very unclear. Possible worsening of the glycemic control during the shingles episodes. So these are all, whenever the infection is there, obviously the sugars will go up and the control is not at all good and the infections will spread and the complications will start rising and finally mortality is also. So we have the recombinant zoster vaccine, shingles. Preferred is the 2 dosages, high efficacy in the diabetes. Live attenuated vaccine, less preferred, contraindicated in the immunocompromised patients. Vaccination recommended for adults more than 50 years, including those with the diabetes as per the current guidelines. See here. So herpes zoster is caused by the reactivation of the varicella zoster virus, latent in the neuron ganglia. So they stay in the neuron ganglia for so many years, maybe 1 year, 10 years, 15 years, 20 years, 30 years, and after some time, so they get activated and then attacks the nerves. See, the herpes zoster characterizes acute pain, and most important is not the pain but quality of the life. So very much disturbed. The common complications, post-herpetic neuralgia, about 5 to 10% of 30% of the patients, very high number. And herpes zoster ophthalmicus, equally high number, 5 to 25%. Age and immunocompromising conditions are well recognized risk factors. Herpes zoster incidence has increased in several countries in the recent decades, predicted to continue increasing with an aging population. So now everyone is living beyond 80 and 85 years, so better to take one Shingrix. May also reflect an increase in other risk factors, use of immunosuppressive agents, or awareness and the diagnosis. See, diabetes is an independent risk factor for post-herpetic neuralgia. So presence of the diabetes itself is a big risk factor for the herpes zoster, followed by the herpes zoster neuralgias. Increased healthcare resource usage following the herpes zoster episodes indicate that herpes zoster is more severe in people with diabetes, and herpes zoster may worsen underlying diabetes. So it's a vicious cycle. So patients with diabetes have a higher incidence rate of herpes zoster compared to the healthy subjects. See the age groups, 50 to 60 years, 60 to 70 years, and more than the 70 years. In whatever it is, so the blue one is the healthy, and the orange one is the diabetes. See the diabetics. The incidence is very high when compared to the healthy population, whatever may be the ages follow after the 50 years of the age group. See the quality of the life impact of the herpes zoster. Your walking ability is reduced, relations with others will be reduced, you don't feel like meeting others, normal work will be disturbed, mood, definitely depressive mood, general activities are reduced, enjoyment in the life has become very, very low, and sleep disturbances will be there. So ultimately, quality of the life will be very much disturbed with this herpes zoster. So this is the injection, Shingrix. So the two things, one is the antigen and the second one the adjuvant system. So antigen is the glycoprotein E, and adjuvant system you have the AS01B that enhances the immune response to the vaccination antigen. So these two to be combined and given it in intramuscularly. Shingrix significantly reduce the risk of the post-herpetic neuralgia and other complications. What are the other complications? You have the herpes zoster vasculitis, disseminated disease, ophthalmic disease, neurological diseases, visceral diseases, and also stroke. So these are all the other complications other than your neuralgia, ophthalmic neuritis or post-herpetic neuralgia. It may cause vasculitis, it may cause stroke, it may cause disseminated disease, it may cause neurological diseases, etc., etc. So to prevent these things, so better to have one Shingrix injection, 2 dosages, 0 and second dose will be between 2 and 6 months after the first dose. So co-administration with the following vaccinations: influenza, pneumococcal, Tdap. Co-administration generally well tolerated. No safety issues raised. No immunological interferences observed. So you can give influenza 1 shot, pneumococcal vaccine 1 shot, and Tdap 1 shot on the same day without any side effects. So Indian consensus guidelines recommends for the Shingrix vaccine in the adults. Yes, APA said more than 50 years of the age group give 2 dosages. Your RSDDA diabetes, that also says more than 50 years give 2 dosages. For your ISN, the nephrology group, they said you can wait till 60 years of the age group and then you give the 2 dosages. Now in the next few minutes, I would like to talk on HPV disease beyond the cervical cancer and the need for the prevention. So these vaccines not only to reduce your cervical cancer, carcinoma cervix, which was very, very #1 cancer in the society in India, thanks to these vaccines, in the near future, we won't see any carcinoma cervix provided all the girls were immunized with HPV vaccination. It is a necessary cause of the cervical cancer and other cancerous lesions around the anogenital region and oral mucosa besides the anogenital warts and the respiratory papillomatosis. So percent of the cases attributed to the HPV vaccination. So your cervical cancer 100% risk will be reduced. Vaginal cancer, vulvar cancer, penile cancer, anal cancer, and oropharyngeal cancer, including the tonsils and base of the tongue. So all these areas, the cancers will be very much reduced with this HPV vaccination. HPV vaccination causes much more than just cancer. HPV related diseases, these are all, some are cancers, some are precancers, some are genital warts. So genital warts, head and neck cancers, oropharyngeal cancer, anal intraepithelial neoplasia, that is our precancerous condition, vulvar cancer and vulvar intraepithelial neoplasia, that is a precancer, vaginal cancer and vaginal intraepithelial neoplasia, that is the precancer, cervical cancer and cervical intraepithelial neoplasia. So all these will be very much reduced with your HPV vaccination. Global burden, 6,90,000 cases of HPV related cancers are diagnosed in males and females around the world each year, every year, nearly 7 lakhs population. See the males and the females, what are all the diseases? What are all the diseases I told right now? Your penile cancer, genital warts, anal cancer, respiratory papillomatosis, oropharyngeal, these are all. HPV infection is estimated to cause up to 4.5% of all new cancer cases worldwide. Imagine. If you see 100 new cases, nearly 5% are caused by this HPV virus. So with this vaccination, so we can reduce that 5% of the total cancers in the society, and you can give good quality of the life. So this is a very, very important vaccination. We all these years we thought that it is very much useful for the girls only, not for the boys. But the research says that even it is good for the boys, much more than the girls. So the most HPV infections clear on their own, but persistent infection can lead to certain cancers. See the 25 to 29 years group 1 here. So the up to 40-45% protection of females, that will rise up to 60% for the males. Why male HPV vaccination is important? Because males remain susceptible to the HPV infection throughout their life. Absence of the routine screening increases the risk. Susceptible to the new and the recurrent infection. Gender neutral vaccination programs increases the protection. Low rate of the seroconversion. At risk for certain diseases and the cancers, your warts, your precancerous conditions, high prevalence rates of the infection across the age groups. So these are all will reduce in the male vaccinations. See, high and sustained prevention of the disease, you have the different strains there. So in the market, you have the 4 quadrivalent and nano vaccination. Nano is 9V and 4 quadrivalent. So antibody response in female 9 to 15 years and the males 9 to 15 years, non-inferior to the responses. Yes. See the number 2, age group. So the females 9 to 26 years, males 9 to 15 years. Dosage schedule 3 dosages, 0, 2 and 6. So that is the dosage of your HPV vaccination, 0, 2 and 6. Now move on to the meningococcal vaccine. Who should get vaccinated? Routine meningococcal vaccine is recommended people with high risk factors. Who are they? Certain immune deficiencies, conditions affecting the spleen, so hemolytic anemias, etc., post-splenectomy, living in close quarters with the many others. So that's what happens in our village areas and in the cities. Travel to countries where the meningococcal disease is very common. Neisseria meningitidis, bacteria, bacterial meningitis, bloodstream infections, sepsis, and life-threatening complications. Here the serotypes A, C, W135 and Y. Conjugate vaccines, effective against the specific serotypes. All these 4 A, C, Y, W polysaccharide vaccines recommended for the specific risk groups and outbreak control. So typhoid vaccines, they are available in injectable and oral forms. Both are available, injectable and also the oral forms, to prevent the typhoid fever. Typhoid conjugate vaccine is the preferred one. Injectable unconjugated polysaccharide vaccine is also available. Oral vaccine. Both types require initial vaccination and may need the periodical boosters also needed. Preferred vaccine for routine immunization programs, recommended for the individuals aged 6 months and older. Single dose IM injection, helps body build the long lasting protection. No routine booster is recommended right now. So this can vary from the country, but India they need boosters. Administered at least 2 weeks before the travel to the endemic area. So when the that fellow is planning to visit India, so definitely 15 days prior to the visit has to take the typhoid vaccine. Single dose into the muzzle. Otherwise oral, 1 capsule on alternate days. Total 4 capsules. Hep A, yes, safe and effective way to prevent hepatitis A, which causes the liver inflammation, your acute hepatitis, etc. But it won't cause any chronic hepatitis, unlike your B and C. Okay, and it won't cause any hepatocellular carcinoma also. Hep A. Typically given as a series of the 2 shots with a specific timing by age group. 2 dose for adults. Specific schedule depends on the vaccine brand. Pregnant or the breastfeeding women, if at risk for hepatitis A, should get vaccinated. So other one, Hep A, I told you. What is HIB? Yeah, H influenza type B. Okay, so that is also there. So risk of invasive hepatitis H influenza B disease increases in the diabetics. Recommended for the high risk adults, including those with the diabetes. That also should include H influenza vaccination. HPV we told, varicella we told, MMR also there. Diabetes at risk if never vaccinated, you can give the MMR also. Vaccinate if no immunity and no contraindications. So vaccination improves the protection against these infections which can cause more severe illness in diabetes. So special populations, especially the elderly, pregnant and immunocompromised individuals. So elderly with the diabetics, you give it, but advise the boosters also. Pregnant women with the diabetes, I told you the Tdap, influenza, and avoid the live vaccines like MMR, varicella during pregnancy, and vaccination ensures maternal and neonatal protection also. Immunocompromised, again, you have to give the booster dosages. How the vaccines protect? The main mechanisms include antigen exposure, antibody production, T cell activation, immune memory formation, and neutralization and the clearance. So by these pathways, they improve your immunity. Travel vaccines, already I told you. Yes. Vaccination, the pregnant and the gestational diabetes, they are all the vaccinations. New vaccines and the Harijan. So certain vaccines are now coming up to protect from type 1 diabetes. See, the diamide vaccine contains GAD65. So you know the GAD65 antibodies, the presence in autoimmune pancreatitis. So that is there. So contain GAD65 protein fragment to promote the immune tolerance. Then immunotherapy, then the BCG vaccine and ATG therapy, umbilical T cells and the liraglutide, and then teplizumab. So there are FDA approved antibody delaying the onset of clinical type 1 diabetes in at risk individuals aged 80 years. So those people are at risk of getting the type 1 diabetes. So these vaccines will help us who are at risk of type 1 diabetes. It is not like the type 2 diabetes. Type 2 diabetes, you can have the risk factors like family history of the diabetes, obesity, your acanthosis nigricans, your skin tags, abdominal adiposity, your hypertriglycerides, etc., etc. But so these are the vaccines in the pipeline to protect from type 1 diabetes. So what are the take-home messages? People with diabetes are at high risk of severe infections and the complications. So vaccination is a crucial protection. Annual influenza vaccination is strongly recommended. Pneumococcal vaccine is also useful. Hep B, Tdap, shingles, COVID-19 are very, very useful. Vaccines uptake remains the suboptimal, very, very suboptimal in India. So you all should be aware of these vaccinations. You recommend your parents, your friends, and your patients who can afford. So definitely go for the vaccinations. Personalized vaccination plans using up-to-date immunization. Maintaining the optimal glycemic control in diabetics definitely helps the good vaccine response. Emerging vaccines targeting the autoimmunity and novel pathogens hold promise for the diabetic populations. Coordination among the clinicians between you and your patients and the public health systems is vital to improve the vaccination rates and outcomes in people with diabetes. Thank you. Thank you very much.